Male, 34, just got out of the Marines after 2 years in Iraq. Admitted complaining of chronic fatigue, joint pains, intermittent rashes, and sore throats. Thinks he has Gulf War syndrome.
Why is he here instead of the VA?
He has a rich uncle Cuddy is trying to avoid, filleting, who doesn't buy the VA's diagnosis of nothing's wrongatosis.
The VA's right. There's no such thing as Gulf War syndrome, especially in veterans who've never served in the Gulf War.
Different war, same place. Whatever was there in 1990 is still there.
What's there can send you home in a pine box, but it can't get you sick 3 months after you've gotten home.
What, so thousands of soldiers are lying about the symptoms?
You send 700,000 people on vacation to Hawaii. Some are gonna come back sick. Doesn't mean it was caused by snorkeling.
He's right. Studies all show the same pattern of symptoms in veterans who were sent to the Gulf and those who weren't.
That's it? You believe her, but not me?
Stick to your guns, Chase. Just because there isn't a single unifying symptom doesn't mean there isn't something going on. It could just affect everyone differently.
You think this guy has Gulf War syndrome?
Of course not. He's depressed and he's looking for a disability check. Most likely because he's just realized that knowing how to barter for sex in 6 languages and open a beer bottle with your eye socket are not the most marketable skills.
Why'd you take this case?
Because a good scientist continually questions his own theories and assumptions.
Cuddy's making him.
And now I'm making you. Do a full physical and recheck his blood for HIV, Hep C, malaria, schistosomiasis, and T strain A Bumani, just to make sure the VA's dotted their I's. And find out every hospital and clinic he's ever visited, every city he's ever lived in, and whether he's ever been on TV.
TV?
Problem could be neurological. Everyone knows TV rots your brain.
Well, it's usually the worst on my palms and the bottoms of my feet. I get these black dots all over them.
I don't see anything.
It comes and goes.
You sure it's not just scrapes and bruises?
I know the difference between a rash and a bruise.
Sometimes it's harder than you realize to distinguish between the two. You obviously exercise.
My problems aren't caused by my workouts.
But you do work out. And by the look of you, pretty strenuously. That's not usually the case with patients whose principal complaint is chronic fatigue and joint pain.
I was in the Marines for 12 years. I'm used to doing PT every day. Just because I can push through the pain doesn't mean it's not there.
We're not saying we don't believe you.
The hell you aren't.
We just need to be specific about what exactly the problems are.
I sleep 10 hours a night, but I feel tired all the time. I constantly get coughs, rashes, sore throats. My knees and hips feel like someone poured sand in my joints. I get these weird tingling sensations in my legs. Sometimes they're cold. Other times, it feels like my blood is boiling. Specific enough? Look, I don't care what you guys call it. Gulf War syndrome, Iraq fever, or just crappy sickness X. I just want someone to figure out what it is so they can cure it.
Except for the supposed pain in his joints, none of the other symptoms he's complaining about are currently evident.
Besides low potassium, probably caused by him overhydrating after working out. His blood work's all normal.
Low potassium could also probably be caused by the experimental vaccines and anti-chemical warfare pills he was given before he deployed to Iraq. Not to mention the fact that whole country's littered with hundreds of tons of radioactive shrapnel from depleted uranium munitions.
You go to medical school in France, there's no trace of uranium in his urine. He was given the vaccines and meds 2 years ago without any allergic or adverse reaction.
Has he ever done any modeling?
We forgot to ask. We should send his urine to the University of Leicester. There's a professor there who's developed a more advanced screening technique for uranium.
The levels are too low for us to detect. They're way too low to cause any damage. Where are you going?
This way. To find out about any television or other media exposure.
Do you really care, or are you just trying to waste hospital resources to get back at Cuddy for making you take the case?
Of course I care. What a horrible thing to say. Do a LexisNexis search to get a copy of his credit report.
Before or after we tell him to eat a banana and discharge him with a psych referral?
I say before. And I say in between, give him a polysomnogram. Sleep apnea could cause chronic fatigue and paranoia. Find out where he went to summer camp.
You okay?
Yeah, it's just a little too much coffee this morning.
Were we walking you to the bathroom?
I wish. Wilson was just in there. These guys know what I'm talking about.
That's his 3rd REM cycle, and his breathing is completely normal. There's obviously nothing wrong with his sleep pattern.
It's not the uranium. It's got to be some other sort of toxin.
Or nothing at all. You really think there's something wrong, or you just want Foreman to be wrong?
Both.
Well, it's not his sleep pattern. If you really think it's a toxin, you can do a liver biopsy in the morning.
We can't leave. If we don't monitor the whole test, House won't accept the results. They'll just make us do it over.
It doesn't take 2 doctors to monitor what's clearly going to be a normal polysomnogram.
Oh, so you want me to stay?
You're the one who thought there was something wrong.
I never said it was a sleep disorder.
You want to flip for it?
Just go.
Oh, come on. Don't be a baby. Fine. I'll stay. You know what we could do?
Here?
Why not? We're surrounded by empty rooms with beds in them.
Yeah, and video cameras too.
So we turn them off.
Yeah, that's all I need is House or Foreman walking in on us.
We have the keys.
No. What if he wakes up?
All right. Suit yourself.
Hello? Is anybody out there? I think there's a problem in here.
What's wrong?
What do you mean, what's wrong? You don't smell that?
Nothing smells, John.
Are you kidding me? It's disgusting.
How long have you thought... Wait. Open your mouth. The smell's not in the room. It's in your mouth.
What's going on?
Good question.
Antibiotics should at least relieve the infection, which will reduce the odor and taste in your mouth.
Not soon enough.
All right. You're gonna feel a little burn.
You never even dipped? Chewing tobacco. Practically everyone in my unit did. But me, I'm so paranoid about cancer.
Well, if it's parotid cancer, it's very treatable if diagnosed early.
My mom had cancer, which is why I know that diagnosing cancer early means before there's any serious symptoms. Certainly tastes like a pretty serious symptom, you know?
We'll know more after the test.
He was just trying to mess with Cuddy for wasting his time. This would have stopped as soon as the patient started exhibiting actual symptoms.
So the question is, why is he wasting our time?
Or is he wasting our time?
You think he's got a medical reason for asking for the guy's credit report?
I don't. Where were you two when the guy woke up?
We just stepped out for a second.
To do what?
To get a coffee. We'd been up most of the night.
Just pushing to make sure we have a complete history. Obviously, we're missing something or we'd have the answer.
You didn't have any coffee when you came back.
All right, already. We confess. You caught us. We snuck into one of the sleep lab rooms to have sex. We shouldn't have done it while we were supposed to be working, and we're sorry. Now, can we move on?
House to do Wilson before you do Chase.
No. You would do House and Wilson before I do Chase. Now, can we get back to work?
She did me once.
She was stoned.
Okay, this time you're gonna feel a little pressure. We're injecting the contrast material.
Hey, could you turn up the music?
Sure. Looks pretty good so far.
Still can't hear it that well.
Can you hear it now? John? John! John, can you hear me? Still no relief?
I got relief. Just got no pee.
If the pills didn't work, you may need a catheter.
You can come here to talk to me about my pee. What's going on?
He's got cancer, all right. But it's not in his salivary glands. It's in his brain. And it's bad. At least 6 tumors, maybe more. He lost his hearing. His sight's probably next.
Death is probably next.